LOU. Zepbound is an injectable prescription medicine that may help adults with obesity or with excess weight, overweight, who also have weight-related medical problems, lose weight and keep it off. Zepbound should be used with a reduced calorie diet and increased physical activity. Zepbound contains Tirzepatide and should not be used with other Tirzepatide-containing products or any GLP-1 receptor agonist medicines. It is not known if Zepbound is safe and effective when taken with other prescription, over-the-counter, or herbal weight loss products. It is not known if Zepbound can be used in people who have had pancreatitis. It is not known if Zepbound is safe and effective for use in children under 18 years of age. Select safety information. Tell your healthcare provider if you get a lump or swelling in your neck, hoarseness, trouble swallowing, or shortness of breath. These may be symptoms of thyroid cancer. In studies with rats, Zepbound and medicines that work like Zepbound cause thyroid tumors, including thyroid cancer. It is not known if Zepbound will cause thyroid tumors or a type of thyroid cancer called medullary thyroid carcinoma, MTC, in people. Do not take Zepbound if you or any of your family have ever had MTC, or if you have an endocrine system condition called multiple endocrine neoplasia syndrome type 2, MEN2. See indication and safety summary with warnings at the end of this video.
I just got back from the pharmacy, and I bet you're wondering what's inside. Let's open it together. This is the once-weekly, single-use Zepbound pen. You may already know that Zepbound is proven to help adults with obesity lose weight, along with diet and exercise. So now, let's take a look at how to use the pen. And if you're like me, you may be nervous to inject for the first time. But don't worry, I'm here to walk you through each step of using it. To start, let's talk about how to store Zepbound. It is best to keep it in the refrigerator. But if you're traveling and don't have access to a fridge, the pens can stay at room temperature for up to 21 days. Now, come take a closer look. This gray cap stays on until you are ready to inject. Double check that the pen is not damaged and that you're taking the correct medicine and dose. Don't use it if the medicine is frozen, cloudy, discolored, or has any particles. And be sure to check the expiration date. The first step is to decide where to inject. You can do it in your stomach or thighs by yourself, or in the back of your upper arms with someone's help. You can use the same area every week. Just don't inject into the same exact spot. Your doctor can help you with these choices. I'm going for the stomach. Oh, and make sure to wash your hands before every injection. Just 3 more steps left. With the pen locked, remove the gray cap and throw it away. And do not touch the base. Place the clear base of the pen flat against your skin and unlock it by turning the lock ring. Press and hold the purple button for up to 10 seconds. The first click means the injection has started. Keep holding. The second click means it's done. The injection is complete when the gray plunger is visible. And that's all. The process is the same regardless of the dose you've been prescribed. Now, you just need to safely dispose of your used pen in an FDA-cleared sharps container. If you don't have an FDA-cleared sharps container, you can use a heavy-duty plastic household container, such as a laundry detergent bottle. And no, this isn't a paid partnership with a detergent brand. Just make sure it's made of heavy-duty plastic, has a tight-fitting, puncture-resistant lid, is leak-resistant, and is properly labeled. Just make sure you leave it in a safe place away from kids and pets. I hope I've helped you feel comfortable with your Zepbound injection, but if you have more questions, talk to your doctor or visit Zepbound.com.
Indication and safety summary with warnings. Zepbound is an injectable prescription medicine that may help adults with obesity or with excess weight, overweight, who also have weight-related medical problems, lose weight, and keep it off. It should be used with a reduced calorie diet and increased physical activity. Zepbound contains Tirzepatide and should not be used with other Tirzepatide-containing products or any GLP-1 receptor agonist medicines. It is not known if Zepbound is safe and effective when taken with other prescription, over-the-counter, or herbal weight loss products. It is not known if Zepbound can be used in people who have had pancreatitis. It is not known if Zepbound is safe and effective for use in children under 18 years of age. Warnings: Zepbound may cause tumors in the thyroid, including thyroid cancer. Watch for possible symptoms such as a lump or swelling in the neck, hoarseness, trouble swallowing, or shortness of breath. If you have any of these symptoms, tell your healthcare provider. Do not use Zepbound if you or any of your family have ever had a type of thyroid cancer called medullary thyroid carcinoma, MTC. Do not use Zepbound if you have multiple endocrine neoplasia syndrome type 2, MEN2. Do not use Zepbound if you have had a serious allergic reaction to Tirzepatide or any of the ingredients in Zepbound. Zepbound may cause serious side effects including severe stomach problems. Stomach problems, sometimes severe, have been reported in people who use Zepbound. Tell your healthcare provider if you have stomach problems that are severe or will not go away. Kidney problems, kidney failure. Diarrhea, nausea, and vomiting may cause a loss of fluids, dehydration, which may cause kidney problems. It is important for you to drink fluids to help reduce your chance of dehydration. Gallbladder problems. Gallbladder problems have happened in some people who use Zepbound. Tell your healthcare provider right away if you get symptoms of gallbladder problems, which may include pain in your upper stomach, abdomen, fever, yellowing of skin or eyes, jaundice, or clay-colored stools. Inflammation of the pancreas, pancreatitis. Stop using Zepbound and call your healthcare provider right away if you have severe pain in your stomach area, abdomen, that will not go away, with or without vomiting. You may feel the pain from your abdomen to your back. Serious allergic reactions. Stop using Zepbound and get medical help right away if you have any symptoms of a serious allergic reaction, including swelling of your face, lips, tongue or throat, problems breathing or swallowing, severe rash or itching, fainting or feeling dizzy, or very rapid heartbeat. Low blood sugar, hypoglycemia. Your risk for getting low blood sugar may be higher if you use Zepbound with medicines that can cause low blood sugar, such as asulfonylurea or insulin. Signs and symptoms of low blood sugar may include dizziness or lightheadedness, sweating, confusion or drowsiness, headache, blurred vision, slurred speech, shakiness, fast heartbeat, anxiety, irritability, mood changes, hunger, weakness, or feeling jittery. Changes in vision in patients with type 2 diabetes. Tell your healthcare provider if you have changes in vision during treatment with Zepbound. Depression or thoughts of suicide. You should pay attention to changes in your mood, behaviors, feeling, or thoughts. Call your healthcare provider right away if you have any mental changes that are new, worse, or worry you. Common side effects. The most common side effects of Zepbound include nausea, diarrhea, vomiting, constipation, stomach, abdominal pain, indigestion, injection site reactions, feeling tired, allergic reactions, belching, hair loss, and heartburn. These are not all the possible side effects of Zepbound. Talk to your healthcare provider about any side effect that bothers you or doesn't go away. Tell your healthcare provider if you have any side effects. You can report side effects at 1-800-FDA-1088 or www.fda.gov/medwatch. Before using Zepbound. Your healthcare provider should show you how to use Zepbound before you use it for the first time. Tell your healthcare provider if you are taking medicines to treat diabetes, including insulin or sulfonylureas, which could increase your risk of low blood sugar. Talk to your healthcare provider about low blood sugar levels and how to manage them. If you take birth control pills by mouth, talk to your healthcare provider before you use Zepbound. Birth control pills may not work as well while using Zepbound. Your healthcare provider may recommend another type of birth control for 4 weeks after you start Zepbound and for 4 weeks after each increase in your dose of Zepbound. Review these questions with your healthcare provider. Do you have other medical conditions, including problems with your pancreas or kidneys, or severe problems with your stomach, such as slowed emptying of your stomach, gastroparesis, or problems digesting food? Do you take diabetes medicines, such as insulin or sulfonylureas? Do you have a history of diabetic retinopathy? Do you take any other prescription medicines or over-the-counter drugs, vitamins, or herbal supplements? Are you pregnant, plan to become pregnant, breastfeeding, or plan to breastfeed? Zepbound may harm your unborn baby. Tell your healthcare provider if you become pregnant while using Zepbound. It is not known if Zepbound passes into your breast milk. You should talk with your healthcare provider about the best way to feed your baby while using Zepbound. Pregnancy Exposure Registry. There will be a pregnancy exposure registry for women who have taken Zepbound during pregnancy. The purpose of this registry is to collect information about the health of you and your baby. Talk to your healthcare provider about how you can take part in this registry. Or you may contact Lilly at 1-800-LILY-RX, 1-800-545-5979. How to take. Read the instructions for use that come with Zepbound. Use Zepbound exactly as your healthcare provider says. Zepbound is injected under the skin subcutaneously of your stomach, abdomen, thigh, or upper arm. Use Zepbound one time each week at any time of the day. Rotate your injection site with each weekly injection. Do not use the same site for each injection. If you take too much Zepbound, call your healthcare provider, seek medical advice promptly, or contact a poison center expert right away at 1-800-222-1222. Learn more. Zepbound is a prescription medicine. For more information, call 1-800-LILY-RX, 1-800-545-5979, or go to www.zepbound.lilly.com. This summary provides basic information about Zepbound, but does not include all information known about this medicine. Read the information that comes with your prescription each time your prescription is filled. This information does not take the place of talking with your healthcare provider. Be sure to talk to your healthcare provider about Zepbound and how to take it. Your healthcare provider is the best person to help you decide if Zepbound is right for you. Zepbound and its delivery device base are trademarks owned or licensed by Eli Lilly and Company, its subsidiaries, or affiliates.